Bismillahirrahmanirrahim. The quote of the day: do what is right, not what is easy. Assalamu alaikum, everyone. I'm Dr. Amna Khan. Today, the topic of presentation is health information systems. Mainly, we're talking about the sources of health information system. I'll be presenting this topic under the kind supervision of my most respectable and honorable supervisor, Dr. Saira Afzal. The learning outlines of today's presentation, they are introduction, sources of health information system, data sources in Pakistan, uses of health information, HMIs in Pakistan, recent updates, and MCQs. At the end of the presentation, the learning outcomes would be participants should be able to describe the data sources tools and how HMIs gathers information in Pakistan. Let's start with the HMIS introduction. Health Management Information System is one of the 6 building blocks essential for health system strengthening. Building block HMIS is a data collection system specifically designed to support planning, management, and decision-making in health facilities and organizations. Let's talk about the sources of health information. So when we talk about the sources of health information, there are 2 kinds of data which are used in the health system. Health data, which is continuous monitoring of births, deaths, and the population data. These are the 12 data sources I would like to talk about. So the first one is census, second is registration of vital statistics, third, notification of disease, fourth, hospital records, fifth, disease register, sixth, record linkage, seven, epidemiological surveillance, eight, oral health sciences records, ninth, environmental health data, 10th, health personal sources, 11, population surveys, and 12th, non-quantifiable information. I'll be more interested in talking about the data sources in Pakistan. So let's start. So population data in Pakistan. So it includes the census, registration system, which is continuous, the sample surveys, intermittent, and the qualitative data, which are basically the attitudes and the views. The registration system. So it is a continuous recording of demographic and social changes of population. Pakistan is preparing a universal, complete population register since 1998 by NADRA, which is the National Database and Registration Authority, registers every 18 years old person, multiple feed and user agencies. Sample surveys. Done to check accuracy of census and vital registration system, conducted by government agencies, Pakistan Demographic Survey, birth stats, estimates, current natural increase and practices population. So the second one is the National Health Survey of the Pakistan, mobility patterns, risk groups, nutrition, smoking, non-communicable diseases, VN, and occupational profile are being estimated. The third includes the Pakistan Integrated Household Surveys, which estimates family size, fertility rates, utilization of health services, education, water, and sanitation. The fourth includes Household Integrated Economic Surveys, which estimates household size and savings. The fifth is Multiple Indicator Cluster Survey of Pakistan by the Ministry of National Health and the UNICEF. Programs on World Summit of Children, Education, Water, Sanitation, Nutrition, ARI, Diarrhea, Weaning, and Vaccination. And the sixth is National Nutritional Survey by the Aga Khan University and UNICEF. Census. So what is census? Let's define it. Census includes the total process of collecting, compiling, analyzing, evaluating, publishing, and disseminating statistical data regarding the population and housing and their geographical location. Population characteristics include demographic, social, and economic data and are provided as of a particular data reference period. Date as of a particular date, a reference period. The types of census includes de facto and de jure. The de facto meaning enumeration of individuals as of where they are found in the census, regardless of where they normally reside. And de jure meaning enumeration of individuals as of where they usually reside, regardless of where they are on census day. Census. The type of census that collects information about the people according to their usual residence, irrespective of where they are at time of census, is basically the de jure census. The type of census preferred in Pakistan. In Pakistan, people do not talk about the guests who need to be reported in de facto. The advantages and the disadvantages would be talked about in this slide. So the advantages are real and close enumeration of population, reliable because of a sufficient time, 2 months, wide variety of data that can be used for policy making. So the disadvantages include time taking, people permanently not living that home are not reported. So under counting, double counting done if after giving data, people migrate to their own towns or after birth or death. Qualitative data. Uh, it includes informational health policies, health legislations, public attitudes, program costs, and procedures, and technology. So the health data is taken basically from the health systems, health facility, and community information systems, and the disease surveillance. The data from health facilities, a system of service-generated data delivered from health facilities. So basically, let's talk about the data being collected from different health facilities. So the different sources would be disease notification for notifiable diseases under national and international surveillance, cancer, stroke, congenital defect, and blindness. The use is early warning, study disease fluctuations, and the limitations include underreporting, atypical cases escape, cover some disease only. Disease register. A permanent record with follow-up of some diseases, namely stroke, cancer, TB, leprosy, congenital heart defects, and blindness. The uses are study course of disease and survival, valuable data on morbidity and treatment. The third one is the hospital records. For prevalent diseases, primary data sources for countries where disease notification vital registration is weak. The uses and limitations include information of health service and utilization study, patients' demographic characters, relationship between diseases. And the limitations include only tip of iceberg included who seek hospital care, admission policy may vary, provide numerator only and not denominator. Population at risk to study frequency of disease. The D includes the other health service records. These are the primary health care and the mother and the child health care, polyclinics, private clinics, schools, and health records. The use is the child growth parameters from the mother and the child health care, and the limitation includes represents only certain segment of the population. The surveillance system, often part of national disease control program for some endemic disease like TB, malaria, COVID-19. Uses valuable data on morbidity of specific diseases are being given, and the behavior surveillance, focusing on risk factors of smoking, malnutrition, etc. It's a program of the population survey. Population surveys. Mostly household surveys would be talked about, and then a health information system should be population based. The three types of surveys are, first one is the community diagnosis, health status of population would be talked about. And the second is the disease factor investigation for etiology. Third includes health service survey, the utilization cost, for example, multiple indicator cluster surveys, and the primary demographic health system. Methods of surveys: interview for subjective issue, population-based; examination, it's valid; health facility records, they're basically cheap; mailed questionnaire, it's cheap and simple. Disadvantages include unreliable morbidity data, expensive, not population-based, and uniform round response, and need literacy. Health manpower stats is by PMC, and number 2 is the mapping health facilities. Environmental health data, identification and quantify the disease agents. Limitation includes data collection difficulty. Non-quantifiable information is policy, program, technology, cost. Other routine stats include demographic, economic, sales and drugs, social security schemes, national health accounts. Modeling estimates and projections, researches. All this information is linked in the management information system. Data needs and essential sources. So here we will be talking about the type of tools being used and the different levels of healthcare system and the decisions of the management. Basically, there are the different level of healthcare systems, which are the communities. So at this level, the type of tools used are the CAP studies, local household surveys, and the surveillance. At the facility level, there will be facility records, birth registers, outpatient data, and the surveillance. At the level of districts, there will be service availability mapping, administrative data, and the surveillance. When we talk about the provinces and at the national level, the data sources would be vital registration, census, national household surveys. And at the global level and at the national level, there will be modeling and the estimates. And the management decision goes from operational to strategic. Uses of health information measures the health status and quantify health problems for local, national, and international comparison of health status, for planning, administration, and effective management, for assessing effectiveness and efficacy of health, for assessing attitudes and degree of satisfaction, for research and training. Now let's talk about from the HMI. We'll be talking about the data sources being used, moving from HMIS for the data sources. Data sources and tools are the facility record systems, OPD register, stocks register, birth registration, expense registration, logbook. Patient record cards, the OPD ticket, referral forms, MCH cards, investigation form, and the TB card, the vaccine card, and family planning card. Third is the data transmission and the processing, monthly reports, yearly reports, immediate reports for epidemic. Number fourth is a population data collection, catchment area for each for each of the defined gives denominator for calculation of the rates. HMIS tools for the lady health workers is the Khandan register, family planning register, treatment register, population area chart, and the monthly report. Flow of information from the first level care facility to the Ministry of the Health in 6 weeks. So the time period taken would be the 6-week time period, starting from the first level care facility, BHUs, RHCs, MCH centers, and dispensaries, and the first aid post. The time taken would be 1 week till the information goes to the district health office, and then within the 2 weeks time period, it would be going to the DG office, and then within the 6 weeks to the national HMIS cell. HMIS limitations includes poor data quality and limitations, poorly paid and managed staff, absenteeism, poor national and provincial coordination, no data from public, private hospitals, GPs, NGOs, and referral care facilities. Due to HMIS limitation, data reporting is complemented by DHIS, which has become the main source of information system. An electronic disease and health indicator reporting system and web application has been developed and is operational at federal level. This is linked with provincial district health system and selected health management information system like maternal, newborn, and child health. Data from multiple sources is entered and collected into central database and visualized through the web dashboard. HMIS limitations would be the poor data quality and limitations. Due to HMIS limitations, data reporting is complemented by DHIS, which has become the main source of information system. An electronic disease and health indicator reporting system and web applications has been developed and is operational at federal level. This is linked with provincial district health system and selected health management information system like maternal, newborn, and child health. Data from multiple sources entered and collected into central database and visualized through the web dashboard. In Punjab dashboard for communicable diseases, namely the disease surveillance system and the dengue surveillance dashboard, along with COVID-19 dashboards, are also operational. An effective healthcare system needs both surveillance system and HMIS. Let's talk about the difference between the HMIS and the surveillance system. We'll be talking about the main differences here. When we talk about the surveillance, the primary objective is basically to control the diseases. And when we talk about the HMIS, the good quality healthcare is the main objective. Reporting must be active and in the surveillance. And when we talk about HMIS, reporting is passive. In the surveillance, the reporting frequency depends on the disease, maybe immediate or maybe weekly. Reporting in HMIS is usually monthly. Through unusual events may generate more rapid reporting. It is cumulative in HMIS. When we talk about the surveillance, individual case information is reported. Now we were talking about the recent updates. Health management information system utilization in Pakistan, challenges, pitfalls, and the way forward. Here's the abstract of an article given. Basically, it was a descriptive qualitative study attempting to explore the perceptions of health managers to identify the status and the issues in the use of HMIS. So overall, 26 managers, all men, ages ranging from 26 to 49 years selected. And so the respondents, they identified number of hurdles resulting in non-use, misuse, and disuse of the data. These included limited scope of the HMIS, dubious data quality, political motives behind demand of data, and an element of corruption in data reporting, etc. So overall, a great deal of political and administrative will is required to institutionalize the transparency in decision making. The legislation and regulations must be implemented, and they are needed to create a conducive policy environment that would help in changing in existing decisions making culture. The sad state of health management information system continues. It's a medical news, which is very sad to know that currently HIS system is somewhat existing in private sector of Pakistan, but public sector still faces great challenges in developing HIS system due to fragmentation of systems and variation in the geopolitical and socioeconomic conditions. So recently, the Punjab government is enforcing HMIS. So it's a recent news in which Punjab is to enforce HMIS in 15 hospitals to monitor performance of doctors. So, Lahore, the news, according to the news, in the Lahore, the caretaker Punjab Chief Minister Mohsin Naqvi on Sunday presided over an important meeting at CM office and with regard to the HMIS system. And it was decided during the meeting to enforce HMIS in 15 hospitals of Punjab under a phased program. The hospitals are Jinnah Children Mayo Services General Hospital of Lahore, and a health management information system will also be enforced in the Dera Ghazi Khan system, Faisalabad, Rawalpindi, Gujranwala, Multan, Bahawalpur, and Rahim Yar Khan. The enforcement of the HMIS would be in the form of registration of a patient in OPD, pathology, radiology, and pharmacy. The test of the patient diagnosis and records of Pakistan patients will be uploaded on the centralized system through the health management information system. The data of patients will be available in the government hospitals through the central electronic medical record system. The monitoring of the performance of the doctors and medical staff will be possible through HMIS. It was informed during the briefing that a better and swift treatment facility will be provided to the patient through HMIS. And Provincial Minister Dr. Javed Akram was also a part of this, and he also emphasized on the implementation of the HMIS system in all the hospital settings. Now it's time of the MCQs. MCQ number 1. In a city XYZ, a researcher team wants to see the course of disease and survival, valuable data on morbidity and treatment in the respective population. Which of the following data sources will provide relevant information to the research team? A, disease register, B, outcome health service records, C, environmental health data, D, health personal sources, or E, the outpatient department?
A.
B.
No, it is
B.
A. No, it is A, disease registers. Number 2, in a country, XYZ census was done to see the population characteristics. The main approach used for the census was to include only these living at their permanent residence, excluding guests and relatives. This type of approach used is the de jure, de facto, C, déjà vu, D, de facto, or E, déjà vu and de jure.
A.
C.
No, it's A, it's de jure.
A.
Number 3, in a country XYZ, a group of students wants to do research on prevalent diseases in the country using primary data sources, but the system of disease notification and vital registration is weak. Which of the following will help them obtaining relevant data? A, hospital records, B, quantitative data, C, health personal resources, D, health service records, or E, all of them?
B.
No,
E. All of them.
it's E, all of them. In such scenarios, we can gather data from all these records or all these services. Number 4, for the Ministry of Health to manage compare data between facilities, districts, and provinces, the HMIS has standardized A, computer programs, B, data collection tools, C, Ministry of Health vision, objective, and targets, D, annual action plans, or E, none of them?
B.
Yes, it is B, data collection tools. Question number 5. This is the data collection tool that keeps patient or the client information, including the identity, history, diagnosis, or service provided. A, OPD register, B, community diagnosis register, C, patient record book, D, inpatient department register, or E, the emergency department register?
C.
No, it's A, it's the OPD register.
A.
Yes, it's A. MCQ number 6 is in a village XYZ, a team of healthcare workers wants to do a household survey to find about the etiology of the prevalent disease in the respective area for the improvement of health information. Which of the following type of survey would be appropriate? A, community diagnosis survey, B, disease factor investigation survey, C, health service survey, D, demographic survey, or E, statistical survey?
A.
No, that would be
A.
it's B, it's the disease factor investigation survey. Number 7, due to HMIS limitation, data reporting is complemented by the following system, which has been the main source of information system in Pakistan. A, Ministry of Health Information System, B, Pakistan Health Information System, C, District Health Information System, D, Management Information System, or E, Rural Health Information System?
C.
Yes.
B.
No, it's C, it's the District Health Information System. Number 8, in a country XYZ, government wants to develop a system for the prevention and control of the emerging epidemic diseases in the respective area with weekly reporting system to the higher official. Such system is the part of A, HMIS, B, DHIS, C, surveillance system, D, PHIS, or E, IRMNCH.
A.
Yes, it is.
B.
It is A. It is it's Charlie. It's the surveillance system. Which of the following is not an important characteristic of useful and effective information? A, accuracy, B, timelines, C, completeness, and D, economy.
D.
Yes, it is D. Number 10th, a company wants to design an effective HMIS system designed for this purpose. The sources of information may be categorized as and A, internal, external, B, personal, organizational, C, useful, non-useful, D, constructive, deconstructive, or E, good, bad.
B.
No, that would be A, that is internal and external. Here's the key of the MCQs and the references of my presentation. This is the link of the YouTube channel. Kindly please like and subscribe all the videos which are being presented. They are posted here regularly. So please like and subscribe and share them as much as possible so everyone can actually understand, because this is an effort being done by Dr. Saira Afzal for the mutual understanding and for public health awareness as well, and for every student. Thank you so much, everyone, for your time and attention today. Thank you so much.